I'm Dr. Lindsay Merriman, pharmacist with over 8 years professional experience, and today we're going to talk a little bit about anxiety, what it is, and how you can maybe manage your symptoms without any prescription medications. Today we're going to talk a little bit about anxiety, what the symptoms are, what the difference is between just everyday stress that you're feeling versus an actual diagnosis of generalized anxiety disorder from your physician. So, what does anxiety feel like? We all know what it feels like to be anxious about something, whether it's school, work, family, finances. We've all been through certain things that cause us to be stressed out more than normal. And the difference in those feelings versus an actual diagnosis of generalized anxiety disorder are when you have the diagnosis, it's when the anxiety symptoms start to really take over your life. So you start to have trouble sleeping, you don't want to eat, or you overeat. Sometimes your heart rate is increased, your blood pressure can be increased, you can even have increased respiration rate. All of those things, when it starts to become physical symptoms that you're feeling in addition to the mental worry, that's when you really want to maybe talk to your doctor about what's going on. Is there anything medical causing this problem, or how you can manage those symptoms? So today, we're going to talk about 5 ways you can manage those symptoms of anxiety without medical intervention. Tip number 1, let's start with diaphragmatic breathing. Basically, what this is, you're going to go somewhere where you're comfortable, where you can really take a few minutes and have some quiet time away from maybe the hustle and bustle of little kids in your house or other things going on. What this is, you take a few minutes to slow your breathing down and really breathe in through your diaphragm. Count those breaths in, hold for a few seconds, and then count the breaths out. Now, this range of counting can be anywhere from 4 to even 8 seconds in, hold for that same amount of time, and then let that breath out for the same amount of time. Some people are going to have larger lung capacity starting with this, and they will be able to start on the higher end of that range. However, if you're not one that usually exercises, or you haven't done any kind of deep breathing exercises in the past, you're going to want to start with a lower number, like 4 seconds. So what you're going to do is, after you have slowed your breath for a couple of seconds, you're going to then take a deep breath in for 4 seconds, hold it for 4 seconds, and then let it out for 4 seconds. But the key here is really also making sure you're breathing through your entire diaphragm around your midsection and not just seeing your belly go in and out or your chest go up and down, because that is when you're not really getting the full effect of this exercise. What this can do is decrease your heart rate, decrease your respiration rate, and in turn, even decrease your blood pressure. Tip number 2 is going to be meditation. This can mean different things for different people. If you've never tried meditation, a lot of times the easiest way to get started is to download one of the many apps that there are available to help walk you through exactly how to meditate, clear your mind, and just get rid of those anxious thoughts that you have at the moment. Also, there are many places around the community these days where you can go and have actual meditation classes. Tip number 3, exercise. This is probably one of the most common prescribed things for anxiety. There are well-known studies that show exercise can decrease the symptoms of anxiety by increasing all the happy hormones that we have in our brains. Tip number 4 would be to research some supplements that you can take. So a few that I really like are Relora, ashwagandha, and magnesium. And all 3 of these have very few side effects along with few drug interactions. But as always, check with your local pharmacist or your physician before starting anything new like that. Relora is a combination of 2 plant extracts, and studies have shown that over 4 weeks of treatment with this, it has decreased salivary cortisol, which is the stress hormone, as well as increased the mood significantly. Relora specifically shows benefit in women with menopausal symptoms. Ashwagandha is an herb that grows in Asia and Africa and is commonly used across the board to decrease stress symptoms. Ashwagandha also decreases levels of cortisol in measurements as well as the symptoms associated with stress and anxiety. The best thing about ashwagandha is that across the board in multiple studies, there have been no side effects. One thing that you do want to watch for with ashwagandha is that some studies have shown it to increase levels of testosterone. So, like I mentioned before, never start any of these without talking to your physician. Magnesium is a naturally occurring mineral that we need to function day to day in our bodies. A lot of people are deficient in this mineral based on the American diet. Many studies have been done with magnesium for multiple neurological disorders, including Alzheimer's, Parkinson's, as well as anxiety. Specific studies have been done with magnesium for even PMS symptoms, showing great benefit. However, the most notable study compared magnesium to a well-known antidepressant, and after the study was complete, there was no statistical difference in the improvement of symptoms, showing the magnesium to be just as effective as an antidepressant prescribed medication. Tip number 5, cognitive behavioral therapy. This is what many of us know as just counseling with either a counselor or a psychologist, and what this involves is them giving you tips on how to control your anxious thoughts. So this can be, again, some breathing techniques, but really it teaches you how to respond to challenges and everyday situations without letting these feelings overwhelm you. They also are able to give you coping mechanisms and different ways to handle different kinds of stress that you might be having if it's something that is taking over your life. Cognitive behavioral therapy can help with specific types of stress that you might have, like going through a loss or grief, and it can also be used alone or in combination with any of the other things that we've talked about today. And a 6th bonus tip today that we didn't go into is a deep dive into your diet. So you really want to go through, if you're having these symptoms, you want to look at what you're doing every day that could be causing this. And a lot of times we are eating foods full of chemicals that can worsen anxiety symptoms that we don't even know about. 2 of these being red dye number 40 and MSG. Now, if you take a quick look at your food, you'll see almost anything in a package has at least one of these in them. MSG can cause increased glutamate in the brain, which leads to increased excitotoxicity and therefore can increase symptoms of anxiety. Red dye number 40 is linked to all kinds of symptoms such as allergies, migraines, and mental disorders such as ADHD and anxiety. So, like I said, just take a quick look at your food labels and see what you're eating every day that might be able to help you manage some of these symptoms. Thanks for watching the video today. If you liked what you saw, please like and subscribe. And if you're feeling symptoms of anxiety, see if any of these tips can help you out.